So why do some doctors make more than other doctors? You may know that doctor salaries can range from $100,000 to over $1 million. But why is this? A lot of things can affect a physician's salary, but there's three main things: geography, type of practice, and physician specialty. Before we go too far, I want to thank today's sponsor, Masterworks.io. Stay tuned to learn more about them. But let's talk about geography first. Geography plays a big role in how much a physician is actually going to make. Areas of need, which might be small towns that don't have a lot of draw, don't have a lot of doctors already, they honestly sometimes have to pay more basically out of desperation to get doctors to come there, because there might not be a lot of draw for people to go there if they're not from there. And since they're small towns, there aren't many people from there that become doctors, just from a numbers perspective. People already want to live on the coast. They want to live in LA. They want to live in New York or Boston. So those places don't have to pay a huge amount to get you to go there. People want to live there already. Those cities have other things going for them. But if you're Bismarck, North Dakota, where your biggest draw is that it's full of friendly people, it's a little harder to get people to come to your town. And you might have to pay a little bit more to entice them. This is an actual email from a recruiter trying to get me to take a job in Bismarck, North Dakota. This one didn't say what the salary would be for the job because they wanted me to respond first and try to reel me in. And nothing against North Dakota, of course. It's just hard to attract people who've never been there or never lived there before. I've gotten job offers for Alaska, rural South Dakota, North Dakota, you name it. They have to offer more to get you to come. The Alaska job, for example, offered me $50,000 a month. And this was to work at a small hospital where you and the ER doctor would be the only doctors in the entire hospital. So what locations make the most money? I look into it a little bit. Here's two articles that I found. One is from ZipRecruiter, saying that the highest pay is in Massachusetts, with several smaller states coming in afterwards. Notice that California is not even in the top 10. And this particular study doesn't even factor in cost of living. Another study from Medscape uses region instead of specific state, and it found that North Central United States makes the most money. Not many big cities in North Central United States. Again, most people don't live in North Central United States, so if you want to get doctors to go there, you have to pay them more to kind of entice them, because it's cold there. Before we move on to the second factor affecting physician pay, let's talk about today's sponsor, Masterworks.io. We've been talking so far about what determines how much physicians make, but what do physicians do with that money? Wealth preservation is an important topic that's not really talked about enough, especially in the medical community. There's a lot of ways to save, spend, or invest your hard-earned money, but there's one way that I didn't really consider until I found out about Masterworks.io. Masterworks is a company that lets you invest in fine art. That's right, art! Now, investing in art is something that I associate with the ultra-wealthy, mainly because art is so expensive. But here's how Masterworks does it. Their team of art experts analyze over 60,000 data points to find trending artists with high potential for growth, like Banksy or Picasso. Then they purchase paintings by these artists. After they go out and buy them, you can purchase shares representing an investment in those artworks on their platform. So even if you don't know a lot about art, like me, you can still invest in it without investing a lot of your time trying to find out which artwork pieces are the best. So now you can include high-end artwork in your investment portfolio without having to buy a $10 million painting all by yourself. Obviously, people like you and me are more used to dealing with traditional stocks and bonds with investing, but I was honestly shocked to learn that contemporary art prices outpaced the S&P 500 total return by 164% from 1995 to 2021, according to Citibank. And Masterworks helped you access this amazing asset class. They've been around since 2017, and their team has over 75 years of art buying experience, with plans to purchase $400 million in art pieces next year. Over 350,000 investors signed up, and Masterworks is already worth over $1 billion. The uniqueness of this opportunity has resulted in a lot of demand, but since I've partnered with them on this video, you can gain priority access by clicking the link in the description. Check them out. Anyway, back to what we were talking about. The type of physician practice that you have makes a big difference in how much money you make. What do I mean by this? You can have the same type of doctor working in the same city and make a drastically different salary. Why? Because of what type of practice they have. Academic, private practice, hospital-based. Hospital-based means that you're an employee of a private hospital, whereas private practice means that you're either joining or creating an independent group that you run yourselves. Academic usually means that you're working at a university hospital that probably also has residents or fellows and things like that. Each one has their pros and their cons. But from a strictly financial perspective, an academic position makes less money than the other two if you're controlling for location and specialty. There's certainly variability to that, but that's the trend. There's of course perks to doing an academic job, because otherwise many people wouldn't do one. Often you're dealing with more complex, more interesting cases. You have a more flexible schedule because you have research time, you work with residents, you do teaching. But part of the problem is because in these flexible times, the teaching time, the research time, that doesn't generate as much income as clinical practice. Most hospital-based or private practice jobs utilize kind of an eat what you kill model, meaning the more patients you see, the more procedures you do, the more money you're going to make. So there's more potential to make more money compared to an academic position. You can see that this study from 2008 confirmed the difference in academic versus private practice income, both in primary care and in a specialty. On that note, let's move to the third factor that affects physician income, and that's physician specialty. What type of doctor are you? A general surgeon, a psychiatrist, a cardiologist? You've probably seen in the past that there's a massive difference in income depending on what your specialty is. So why is that? Let's look at this chart here first. You can see that plastic surgery is at the top, pediatrics is at the bottom, and again, these are averages. There's a lot of exceptions, especially in light of the other factors we already talked about that can make income vary significantly between doctors. But you might notice, if you know anything about these specialties, that a big thing that affects the top versus the bottom is whether or not they do procedures. Procedures can be a big moneymaker for doctors because of how insurance bills for them. Performing a procedure, anything from a cyst removal to a colonoscopy to a gallbladder removal to a cardiac catheterization, it's much better reimbursement from insurance than a simple office visit to check on your diabetes. There's a lot of reasons for this. Procedures take more training because they take more time, they're more complicated. You often need more people to help with a procedure. You might need anesthesia, you might need a nurse, you might need another doctor. There might be extra equipment that's needed, or other expertise from people that aren't doctors. This all increases billing through insurance. Plastic surgery, orthopedic surgery, urology, GI, all do tons of procedures. Pediatricians and endocrinologists do almost no procedures. Again, there's exceptions, but usually they don't. That's really a big part of what it comes down to. Pediatric specialists compared to adult specialists make a lot less money as well because kids tend to need less procedures than adults do. Kids don't need screening colonoscopies. Kids rarely need their gallbladders removed. Kids also just don't get sick as often. Because of that, often pediatric specialists need to work at big academic hospitals that are kind of hubs that people will refer to if kids get sick, because out in the community, it's a little bit more rare to encounter rare pediatric diseases compared to rare adult diseases. So then if they're working at an academic center, they're going to make a little bit less because of what we talked about earlier. So there's a lot of things at play here. It's not all just as simple as you are in this specialty, you're going to make more money. But that's what's kind of interesting, in that the difference in pay for specialties has essentially nothing to do with the hours or number of days that they work. Obviously, if you do more procedures, you're going to make more money. But it would be very easy to make more money doing a procedure-based specialty, even if you're working less than someone who is doing a specialty that doesn't really have very many procedures and they're working more. The pay is really dictated by what insurance finds valuable and will reimburse more for. It may seem a little bit backwards at times, but unfortunately that's the reality of the US healthcare system right now. Again, there's no absolutes, there's always exceptions, but these three factors are kind of good rules of thumb to go by. Thanks for watching. Thanks to Masterworks for sponsoring. Check out the link in the description. If you have any questions, feel free to comment below and I can try to answer them. Questions about specialty or location, whatever you can think of. Also, please like and subscribe, and I'll see you next time. Thanks.